In today's lesson, we are going to focus on radiographic projections. Radiographic projection is a positioning term that describes the direction or path of the central ray of an X-ray beam as it passes through the patient, projecting an image onto the image receptor. So most times, the term position is used in clinical setting, but the term projection is considered to be the most accurate of them all. It is used in describing the path at which the X-ray, the central ray of the X-ray beam, passes through the patient. Now, there are many common terms used in projection. There are many common projections that we use in medical radiography. And in this video, we are going to go through them step by step, understanding them with examples. So let's get started. The posterior-anterior projection, which is AP projection, refers to when the central ray passes through the posterior part of the body and then exits the body through the anterior part. An example of this is when we have a chest X-ray, that is an erect chest X-ray. The X-ray passes, which is the central ray, passes through the posterior part of the body and then exits through the anterior part of the body, hitting the image receptor and therefore producing a radiograph or an image of the chest. Another type of projection is the anterior-posterior projection, also known as the AP projection. It's just like the opposite of the PA, which we just discussed. But in this case, the central ray, which is the X-ray, passes through the anterior part of the body and then exits through the posterior part. So in other words, we call that the AP projection. So in these both cases, we can easily describe projection as where the central ray passes through, where it enters the body through, and where it exits the body from. So in the case of posterior-anterior, the X-ray is going to enter through the posterior part and then exits from the anterior part before getting to the image receptor. And then in the case of the anterior-posterior, like for example, when you have like abdomen erect X-ray, doing abdomen erect X-ray, you have an AP projection. So in this case, the X-ray passes through the abdomen and then exits through the posterior part, which is the back towards the spine, to the image receptor. So that is what we call an AP projection. Lateral projections are also widely utilized. In a lateral projection, the X-ray beam passes through the patient from one side to the other. This projection is particularly useful for examining structures that lie close to each other in an AP or PA view, such as the vertebral column or the retrosternal space in the chest. Now, lateral projections are mostly used when trying to visualize the vertebral columns. That is when you are doing a lateral for probably lumbosacral spine X-ray or for cervical spine X-ray also. Other projections also include the oblique projection. Oblique projection is another important category of projection in radiography. Here, the patient or the X-ray tube is angled, allowing visualization of structures that may be superimposed in standard AP or PA or lateral views. Now, this can actually come as an exam question. They might ask you, what's the reason for doing an oblique projection? And the answer is quite simple. It's just because most structures in AP or PA or lateral view are superimposed. Oblique projection will help you visualize those or appreciate those structures very well when compared to the AP, PA or lateral view. So this projection is actually used mostly for lower limb or upper limb. It's also used again in dental radiography to see the roots of the teeth more clearly. Radiographic projections must be carefully planned and executed to minimize radiation exposure, and to ensure high quality of images produced. Proper patient positioning is crucial as incorrect alignment can lead to diagnostic error or a need for repeat exposure, which increases patients' radiation dose. So, as a radiography student or radiologic technologist, you are to master positioning in order to avoid repeats and also ensure that your patients are comfortable doing the examination. This is going to lead to better image, diagnostic image, and also patient care.